Joining us live is Dr. Thurein Hlaing Win, a healthcare influencer from Myanmar who experienced the earthquake in Chiang Mai in northern Thailand. Hello, sir. So can we describe the moment the earthquake hit? What did you see and feel?
So I was, my wife and I at the pool. So I was in the water at that time. I didn't realize that there was an earthquake before because I was in the water. It's the most flat place. And that, fortunately, we're in a very flat place at that time. And then I started feeling dizzy, and I can see there's water overflowing from both sides, as you can see from the pool. Water from the pool kind of overflowing from both sides. And then people started panicking about it because I never seen and experienced such kind of magnitude before. So I didn't know what to do about it. And then people started panicking about it and trying to take shelters. But I believe that being in the water at that time is the most safest place at that time. So I have waited until it settled, and then I rushed to the land, and then I found out that my friends and my families have been posted about earthquake related problem. I thought it was in Thailand, but actually it was in the central Myanmar.
Well, how are your family and friends coping? Is aid reaching those most in need?
Well, unfortunately, they don't. My family, my parents are in Yangon, so which is relatively safer than in Mandalay. But more than 80% of my friends in Mandalay got hit. This is the impact of this earthquake has never been experienced in our life before, because this is what we are told is this is the largest earthquake and the most damages in 100 years. So I can see that more than 80% of the building above 3-story buildings got collapsed. I can see a lot of people have been stuck, and then they're not getting any help. The current aid that they have been getting is from the local people. People are trying to help each other, they're relatively fortunate people trying to help other people which are being stuck or already lost a lot of things. So that's what they've been suffering. So we have no shelter, we have no electricity, and subsequently there's no water, and then we have no machinery. So people have been still stuck in the collapsed buildings, and the death tolls that you got is the confirmed one. So there are still a lot of people who've been stuck in the collapsed buildings. We estimated it could be hundreds of thousands.
Well, how big of a challenge is this earthquake for Myanmar's medical system?
Yes. It's already under a lot of pressure because of all these complicated issues going on, and the healthcare system is already on the edge of nearly collapse. And this earthquake is a fatal blow, I have to say, because the infrastructure, the healthcare system couldn't help other people because it itself is collapsed. I can see a lot of emergency departments in various locations of the country got collapsed. A lot of medical professionals, doctors and nurses are damaged as well. So it's about, we couldn't even do what to do about it. It's like they couldn't even help other people because they are also the one who've been suffering. So I would say it's the fatal blow to the healthcare system of Myanmar.
Well, access to safe drinking water is critical for those affected by the earthquake. Are rescue workers prepared for the possible spread of waterborne diseases right now?
Yes. So the problem is earthquake not only destroying the buildings, it also destroying the roads as well. So communication system is hugely disrupted, including the phone calls, internet services, and also the transportation to them as well. And Myanmar is a very hot country, especially in this time of the year. So it's the summertime in Myanmar. Temperature reaches around 45, 50 degrees Celsius and sometimes. So the shortages of water and also the earthquake is so huge that it impacts the underground water wells as well. And that's how the central region of Myanmar rely on their safe drinking waters and the usage of water as well. So it is not the disruption of the water shortage is not an immediate danger, but in like 2 or 3 days, it will be really obvious that there will be shortage of water, electricity, and shelters, almost everything. We are in like dire needs of all the rescue aids that we can get.
Okay, thank you so much for all the information there. Dr. Thurein Hlaing Win, a healthcare influencer from Myanmar who experienced the earthquake in Chiang Mai in northern Thailand. Thank you so much for your time.